CDC says a high number of COVID-19 cases are being reported right here in the Bronx and Queens. Health officials are also expecting those numbers to rise again after the holiday weekend that we just had, when many people gathered indoors or passed through crowded malls and airports. Now, officials continue to push for people to get their COVID-19 shot.
They also want to make sure you don't forget about the flu vaccine. This year's uptick in flu cases is happening when children's hospitals are already dealing with a surge of illnesses from RSV. Joining us this morning with more on what's being called a tripledemic, CDC Director Dr. Rochelle Walensky. Nice to have you back on Good Day New York.
Always good to be with you.
So the tripledemic, does that mean that you get all three things at one time, or just that it's happening in your family?
We have all three of these viruses circulating at high levels right now. Certainly it is possible to get co-infected with 2 or 3 at the same time, although that's less likely. What we worry about is that especially the young and especially the elderly are at highest risk for either RSV or COVID-19 or influenza, and they're all circulating at high levels right now.
So, we're hearing a lot of people in our area, Dr. Walensky, are not getting the booster. They're not getting the vaccine, they're not getting the booster because they don't have faith that it really works. Is there evidence that it works? Because we hear people, even in government, they get the vaccine and a month later they got COVID.
Right. So what we know right now is in New York specifically, we have about 13% of people who are eligible to get their COVID-19 updated vaccine have gotten it, which means we have a long way to go. To be very clear, we have seen that this new updated booster, we had data that were just released about a week and a half ago. This new updated booster does improve protection against infection. It's not 100%, but it does improve protection. What we also know is that we anticipate this booster will really have protective effect against severe disease, hospitalization, and again, new updated data show that compared to those who have gotten the COVID-19 booster dose, 14 times less likely to die compared to those who are unvaccinated.
Let's talk about our areas, because you're seeing some high rates of COVID in specific areas, including the Bronx and Queens. Why is that?
So, we have seen and we follow very carefully our COVID-19 community levels. These are levels of infection that are circulating, severe disease that are coming into the hospitals, and how high our hospital levels are, how many beds are occupied by people with COVID-19. Very high levels in the Bronx and Queens, as you noted. And in those areas, we do specifically recommend masking. Also, lots of areas in New York with medium community levels and COVID-19 community levels. And again, there, would recommend masking if you are risk of severe disease or if you're going to be around people at risk of severe disease. Certainly because the holidays, we know a lot of people gathered. We have more holiday season ahead of us, and we really want people to be well to go into that holiday season.
Now, it's interesting that you can track the data for COVID-19 in Queens and in the Bronx. You're saying that's high. Do you have that same information for RSV and maybe the flu? I think a lot of people would be interested in knowing, is my community at high risk for RSV or the flu?
We track it down to the community level for COVID-19 and regional levels for both influenza as well as RSV. And what we've seen at the regional level, at the state level, is that both of those infections, influenza as well as RSV, are now increasing in the state of New York and all of the Northeast. We've seen data that demonstrate that about 4 to 5% of doctors' visits right now are for respiratory influenza-like illness.
Doctor, do you think we're still at that point where the city should be mandating vaccines to have a job?
Here's what I can say is that every day for COVID-19, we are tracking somewhere in the 300 to 350 deaths per day. We do know that if you are vaccinated against COVID-19, if you're vaccinated against influenza, you are at much less risk for severe disease. You are at much less risk for dying. Right now, I don't believe that any of these deaths are not preventable. We do, on a rare occasion, people are so sick that they can't be prevented, but truly through vaccination as well as through our antivirals, if you get sick, if you present to the doctor, get your antivirals against influenza, against COVID-19, nearly all of those deaths should be preventable.
So, doctor, when my daughter had the flu, I went to go get Tamiflu. The line at the pharmacy was ridiculous. What is going on with, a lot of our medications? Because I hear, you know, we're having a shortage of them. Tamiflu is one of them.
Yeah, certainly, and the FDA is following this very carefully. What I can say is that, you know, this is earlier in the season than we generally see. We haven't seen influenza rates this time of year for over a decade, and so I know I would recommend continuing to go to your doctor. Sometimes if your doctor, certainly not for Tamiflu, but for other things, might be able to prescribe an alternative, and that FDA is working closely with the manufacturers to facilitate.
So at this point, do you foresee it getting worse as the winter goes on?
Well, you know, certainly we can't predict what's going to happen with an influenza season or with an RSV season. In some parts of the country, we've actually seen RSV starting to come down, which is promising. So, you know, hard to predict. I think the most important thing that we can do to start seeing those trends come down is to do all those things that we can to prevent it, to get vaccinated against influenza, COVID-19.
Dr. Rochelle Walensky from the CDC, thank you so much for being on Good Day.